Joining us now, we have Dr. Nadia Krupp. She is a pediatric pulmonologist from IU Health. She is here to talk about a new study about teens, COVID, and vaping. Dr. Krupp, welcome.
Thank you.
So let's just get right into it. Now, a new study came out saying that teens who vape are 5 times more likely to contract or test positive for COVID-19 compared to their counterparts who do not vape. What are your thoughts about this?
I think it could be for a couple of reasons that we saw the results of that study. Part of it is that when you already are vaping and have some underlying susceptibility because your lungs are already injured from vaping, if you catch COVID-19 on top of that, then you're more likely to get symptomatic enough that you get to the point that you require testing. So the interaction of those two processes will make people, instead of being asymptomatic or very mildly symptomatic, will make them appear sicker and will raise people's suspicion that this could be COVID. I think that's probably the main driver behind that. The other thing, though, is that when people vape or smoke, if they're inhaling something that is damaging to the lining of the lungs, you damage the normal barriers between the air and the bloodstream, or the air and the cells that line the respiratory tract. So you could theoretically actually get more virus into those cells because those normal barriers are impaired. So that's possible. That hasn't been proven. But knowing about how lungs behave in response to vaping, that could be another explanation.
So just in my conversations with the public and reading the literature about vaping, it seems to be building, it's slowly building that there is evidence that it could be dangerous to our lungs, but in a way that it's sort of not enough for the public to pay attention to. That this, I think the way public health works is like maybe we'll have evidence 10 years down the road,
right?
Just the way that science works. But so we could say that what we know so far, that vaping isn't completely safe. There's something going on there in the lungs. So from your thoughts as a pulmonologist, what does vaping do to the lungs?
So a lot of people think that when they vape, that the substance that they're breathing in is just water vapor or flavored water vapor. That's not true. It's an aerosol. It's an actual chemical substance that gets heated to the point that it turns into an aerosol, just like air freshener or cleaning products that are compressed in a can. And then you spray that into the air. Those chemicals and particles aren't just water either. When people vape, that liquid has solvents in it. It has nicotine in it a lot of times. It has flavorings that are intended to be swallowed and ingested, not inhaled. And it has a lot of times contaminants in it because that industry is not very well regulated, and so we don't know exactly what's in it. The other problem is that sometimes people will think that they're vaping one type of e-liquid because they get it from a friend, or they buy it online, or they trade with someone, and it turns out that they're using a much different product. From what we know so far, people who vape kind of what we think of as typical vape liquids, so they may or may not be flavored, they may or may not contain nicotine, but they come from a vape shop. Those people are at risk for what we call vaping-related lung injury, which honestly looks a lot like COVID, and can land you in the hospital and can give you fever and coughing and vomiting and shortness of breath and a lot of symptoms that overlap with a COVID infection. That risk is even higher if you use a vaping product that's not necessarily a standard one from a vape shop, but is something that somebody concocted in their garage, or contains THC or has other contaminants in it. But even what people think of as the quote unquote normal vapes are not safe. We've seen kids, especially starting last year, a little over a year ago, teenagers and young adults admitted to the hospital with life-threatening lung injury. Some of them had just started vaping. Some of them had been vaping for several years. But the duration of how long they'd been vaping didn't really seem to be all that important. They just, at one point, either it was a different product they used or a different amount of vaping, where they increased how much they were using it. They got to a tipping point where they landed in the hospital and were quite sick. So I do stress to people that it is not a safe thing to do. You're rolling the dice. If you decide to vape, you might be one of the people who doesn't get lung injury, but you might be one of the people that ends up on a ventilator in the hospital. And we cannot predict who is going to get sick and who won't.
So if you were to talk to parents and teens of Indiana in terms of vaping during the time of COVID, but then also beyond, what is your message to them about their children, their teens, and vaping?
My message primarily would be do your best to not start in the first place. And if you have vaped, then please stop. It's not healthy for your lungs. It's not proven to be safe. Open and honest discussions between parents and teenagers are really important, because a lot of teens think that it's safe and think that it's fine and don't think that it's something that they need to or should discuss with their parents. And it's really easy to hide. Those vape devices can look like household or electronic devices like USB ports or phone accessories or all kinds of different things. And so it's difficult for parents to police it by, say, inspecting bedrooms and things, because it's hard to find. And so really having honest discussions with your teenagers about what they're doing and why is the way to go. Some teenagers will use it just because their friends are and they think it's harmless. Others might be feeling stressed and anxious, and so they're using it to try to calm those nerves. And so also exploring not just what they're doing, but what's driving them to do that is really important. We don't know if you're vaping now, what that will do to your lungs 10 years from now. That's the other concern, not just for the short term, will you end up in the hospital, but also will it give you a more chronic version of lung injury that could be permanent for the rest of your adult life. Nobody knows that yet because it hasn't been around long enough.
Right. Well, Dr. Krupp, thank you so much. Some really important information for our audiences. Thank you.
Absolutely, thanks.